This episode of the Naperville Moms Network is brought to you in part by presenting sponsor, Innovative Orthodontic Centers. Personalized, cutting-edge orthodontics for a smile that reflects the real you.
Welcome to the Naperville Moms Network, a mom-focused talk show navigating the ups and downs of being a mom and a woman. My name is Dr. Kathy Suber, and my co-hosts Erica, Sarita, and Patty are joined today by a special guest, Dr. Manal Ibrahim of Innovative Orthodontic Centers. Dr. Manal is the mother of two, an expert in her field, and will be helping us navigate the topic of oral health for your kids. I think I say, did you brush your teeth 1,000,000 times a day at my house? How does that go at yours?
Same here. You know, I have two little ones, so I have a 6-year-old and 3-year-old. I believe we took my 6-year-old when she turned 2 for her first visit to the dentist, and it went well. We go every 6 months. Fine and dandy. My 3-year-old, on the other hand, not compliant. He's great in all other arenas, the haircut, the doctor, but he has decided I am not going to open my mouth for you or anyone. So 2 questions for those with younger children. At what age should parents bring their child for their first dental visit? And secondly, any tips and tricks for one who is not cooperating?
Well, believe it or not, the American Academy of Pediatric Dentistry recommends that you take your child at the age of 1, which seems really young for a lot of people, but it's really a means of preventing issues from happening. We're not really doing dentistry at that age, but we're just checking things out so that we could prevent cavities, and then we do those annual checks just to keep the children nice and healthy. Believe it or not, also another really interesting fact is 45% of all 3rd graders have cavities. Wow. So we want to watch.
That's a lot.
That's exactly what we want to prevent that from happening. So it's no fun to do fillings on little kids, and it's no fun for them or the parents. It's very stressful. So those visits are really meant as a preventive measure.
How long should a child brush their teeth? I've heard different things. Is there a certain, I should set a timer, or is there a certain?
We usually say about 2 minutes, but I really love it is a long timer. I really love the electric toothbrushes because they have the timer built into them.
True.
So they don't have to do the little flip thing or anything. So it's a nice way for them to know that they are doing a good job.
That's an easy way to do it.
Yeah,
so
for sure.
as your kids are getting older and you know down the road you're going to have to take them to an orthodontist, when is an ideal age to start that? Do you wait for the baby teeth to be all out and get your permanent teeth in? What's your advice?
So most people think that you should take your child when they have all their baby teeth gone and all their adult teeth in, but at that point it's actually too late for us to do anything to help them with some of their bigger problems. So the American Association of Orthodontists recommend that you take your child at the age of 7. So it's not meant for us to do treatment, but it's a baseline exam, just like you get an eye exam and an ear exam, so we could start to diagnose things or say, hey, you look great, see you in a year. If we diagnose some of the critical factors that we know to look for, we may implement a very short plan to just kind of get everything into an ideal position that's going to significantly enhance their development of their jaws and their teeth up until that teenage year. And then at that point, we may shorten their treatment because we've taken care of all the bigger problems. And it also makes a big difference with their self-confidence, which I really believe is a huge factor in doing some early treatment if they need it.
Oh, because you're doing it while they're young, and when they go to middle school, which is when that self-confidence really kind of hits them, then they don't have to have so much done during that period. That's perfect.
That's really good to know.
I know my son is doing 2 stages, right? He was either 7 or 8 and had a palate expander. So can you talk about that? Does that open up the jaw? How does that help the future care? Because I know a lot of people are like, what do you mean you're getting braces on your 8-year-old? Like, they don't seem to understand that there can be 2 phases of it that can really help in the development of the teeth overall.
Absolutely. So an expander really makes your upper jaw the right size. It's a bony appliance, orthopedic. And by doing that, we can eliminate cross bites. We can also just make room for some of the adult teeth to come in. And it's not meant to fix everything, but it can certainly solve a lot of their issues depending on what they are. Our goal is if a patient needs a phase 1 treatment, we keep it under maybe 9 months to 12 months. And that way, when they are a teenager and they have all their adult teeth, it can make that treatment extremely short, maybe 6-7 months. Maybe with Invisalign, they may not even need braces or want braces at that teenage year. So it's a really nice thing to do for your child if they need it.
Yeah. So what are your thoughts for teenagers, braces versus Invisalign?
That's a good question.
It's a great question, and a lot of people ask this question. It's important for everyone to know that these are both orthodontic appliances. One is fixed on your teeth and one is removable. So you can imagine that one of them needs a lot more patient participation, and so
A little more user error.
User error can happen. So picking the two really depends on your child. If you have that really, really routine, rule follower, super disciplined patient, Invisalign's a great tool to use for their orthodontic problems. Someone could be extremely responsible but not want the added responsibility of those trays and keeping track of them. And those are the patients that we use braces on. But don't let anyone tell you that Invisalign doesn't work. If it doesn't work, perhaps it's the child that personality maybe would have fit better with braces. You also want to go to somebody who's an expert in Invisalign, because sometimes if you're not an expert in your field, the tools that you're using don't give you the results that you're looking for. And so then the patient result is compromised. So, but Invisalign is amazing. Again, it's not right for everybody just based on their personality, but in my practice, we offer it to anybody that wants it, starting at the age of 7.
Oh, wow.
So anyone can have
that.
Invisalign as long as they're disciplined in that aspect of their life.
Right.
That makes sense.
Well, and speaking of discipline, I know Patty has older kids, right?
Yes.
And after you're done with either Invisalign or braces, you were supposed to wear a retainer.
Yes.
I had buck teeth as a child. I was a thumb sucker, and I could close my mouth before I got braces and stick my tongue halfway out, which was a really attractive look for me. And so I was happy to get braces to correct that problem, but I had them for a good 5-6 years because I was still kind of sneaking a thumb in there, which is for a little too long. But anyway, once you are done with the braces, you're supposed to wear a retainer. What percentage of people you think do that? And for you, Patty, how has it been with your children?
Not well. Like, I'm just thinking of the Invisalign. By the time my middle son got braces, Invisalign wasn't an option, and he would never have been the candidate for that. They go away to college, and you're not there to remind them in a gentle, nurturing way to put their braces in or to put the retainer in. How do you do that? Like, when is the, how do you get your kids to transition to being responsible for their own oral care when you've been doing it since they were 1, now that we've so how do you do that to get them to be responsible for it?
It's definitely tricky, as we all know, because it takes that routine person to stick to the routine.
Right.
Interestingly enough, our patients that have gone through Invisalign are already programmed to wear these trays.
Yeah,
so asking them to wear a retainer now just at night, they're like, snap, no problem. Super easy. Our braces patients in my practice get the same retainer that the Invisalign patients get. So they love that the hardware is gone, and now they have these beautiful clear trays that they wear at night called retainers. So it doesn't seem to be as much of a struggle for us, in truth. I think if we can get them a retainer that looks aesthetically acceptable and is really comfortable, that's going to be the solution. Otherwise, good luck getting your son to wear his retainers at night.
Do they do headgears anymore? I had the headgear that actually went on top of my hair. It was a light jean material. Again, a really attractive look for me. And then came into my braces. It was awful. I was supposed to wear it all the time.
All the time at night?
Oh my gosh, no. So I would get on the bus in 7th grade and I would remove it. Of course I would remove it, right?
Would.
It was awful.
Yes.
Some people got to wear the nice little cute ones that went underneath it, but I had like that. Do they do that anymore?
I have never ever purchased one headgear in my practice because if I wouldn't wear it, I'm not going to ask anyone, regardless of their age, to wear it. People still use it. People still use it. We can use Invisalign to do what headgear does, and so it's an amazing option for patients. But it is meant to change the jaw. And that's why headgear is used. But again, if you follow the standards of care that are today technology driven, you're not really going to be using headgear.
Okay.
But
well, I'm going to time travel back and use you instead. So 'cause that was not fun.
I don't know, the light jean color. That sounds lovely.
I know. Well, and to shift gears a little bit, you're also a mom and have 2 kids. So how do you manage to, be here sharing with us, run a practice and a couple of practices with your husband, and then also balance being a mom? What are your kind of tricks that you use for that?
Well, I wanted to let you know that the struggle is still real, getting them to brush their teeth every day. That's good to know. It's not just your kids, but being that my husband and I are both dentists and, are in the professional atmosphere and we are passionate about what we do, we also have to pick and choose how we spend our time because our kids are our number one priority. So really, honestly, every second that we're not in the office, I'm home with the kids, or the kids will come to the office. Our office is pretty kid-friendly. We've got a movie theater and a game room, and so they can hang out in there. Sometimes their friends come, believe it or not, and hang out with them at the office because it's fun. But, it's just trying to carve out your time and not be so into just work that takes over your life. They are my number one priority, of course, and I spend every second with them that I can.
Do either of them, did they go through orthodontics then when they were younger?
Yeah, did they have like the perfect teeth?
I didn't realize that my husband had a crossbite when we got married. So both my kids, that might have been they both had expanders when they were very little because they needed them. And then my older son had a little bit of phase 1 braces.
Okay.
At this point, they still have yet to have their phase 2 because they've gotten such a great response to their early treatment. We haven't started their phase 2 yet.
Yeah.
So as soon as they have all their teeth, we'll probably do some treatment. They both want Invisalign. We'll see if they're good candidates based on their responsibility at that point.
I had Invisalign as an adult about a year ago, and one way to get someone to use the retainer is to have them pay for it themselves. And then let me tell you, I will never go an evening without putting it in because you've invested so much in the first place, and I think that's tough for a teenager to understand is what sacrifice and investment that was for the parent.
That's true.
They contributed.
Or letting your college age kids know that if they need any other work beyond that, it's on them.
Yeah.
You've done your part.
With it all itemized out. They will. That retainer will be in.
Keeping your pearly whites happy, healthy, and functional is a lifetime process. Thank you, Dr. Ibrahim, for sharing with us today. We'll be right back with more from the Naperville Moms Network. Stay tuned.